An overview of the new 5-year strategy, Blackpool Teaching Hospitals NHS Foundation Trust 2022 to 2027. Welcome to our overview of the new 5-year strategy for Blackpool Teaching Hospitals NHS Foundation Trust, and thanks for taking the time to read our plans and ambitions, which set out what we'll do between now and 2027. The plan has been developed over a number of months, taking into account feedback we already had about our services and including ideas, suggestions and priorities from the NHS nationally and regionally, as well as colleagues across the organisation and wider health and social care system in Blackpool, Fylde and Wyre. In bringing it together, we've also, and most importantly, linked in with local people, partners and especially patients and their families to understand what they think and need us to do differently. This document sets out the plan to deliver those improvements, and we need everyone in Blackpool Teaching Hospitals and the community to be part of it. The team is up to the challenge. You only have to consider their hard work and dedication throughout the pandemic to know this. We're incredibly grateful for everything everyone has done across all hospital and community settings, and not least in people's homes. We're going to need to work together with local people, partners and the wider health and social care system too. But again, we have strong relationships already in place from supporting each other through COVID. It's been the most challenging of times, but the strength, support and solidarity across Blackpool, Fylde and Wyre has been incredible and will provide us with the energy and determination to continue. And so, over the next 5 years, we'll focus on making improvements that really matter and make a difference to everyone. Staff who feel supported and valued always provide the best care and experience for patients and their families. So it's important we make our organisation a place where everybody wants to be. Whether that's opportunities for local people to work and develop their careers with Blackpool Teaching Hospitals, ensuring those already with us want to stay, or attracting new skilled colleagues to relocate into the organisation. Having the right people is the key. It's important when making plans to also remember that we live and work in one of the most popular tourist destinations in the country. It's both amazing and sobering to note just how many visitors come to the Fylde coast, not just during the summer months but all year round to explore our local landscapes and beaches, legendary hospitality and bustling nightlife. This is focused of course on the famous seaside resort of Blackpool with its heritage and tourist attractions. It's an important part of who we are and also the foundation of our economy, but it adds demand into services that need to be provided without affecting local people and their needs. Most importantly, we need to make sure communities have what they need and experience the very best healthcare equally. Whilst the area has some of the most affluent and sought-after postcodes in Lancashire, we also have some of the UK's most deprived neighbourhoods, where people struggle with poverty, reduced opportunities, poor health, and can often die earlier than they should. This 5-year plan sets out how we'll prioritise and tackle this, promoting equal access to support and services, as well as being clear that we have to work with other organisations and local people to develop and provide the very best healthcare for everyone. We know it's not always easy to find a service or understand how it all works, and we need to improve this with everyone involved. This might sound simple, but getting the basics right is the first thing we need to do. That means providing good services, recruiting and retaining good people, and making sure that when things aren't quite right, we welcome feedback and address the problem. Please do read this overview, and if it inspires you, please get involved. There are many ways to do this, and we need as many people to help as possible. Know also that whilst this plan provides a way forward to 2027, it will change along the way, bending to new ideas, taking on suggestions, recognising things that have worked in other places, and of course reacting to unknown challenges that might come along, such as a global pandemic. There's lots to do, but together we can achieve this and improve lives, and that's the very reason we're here. What's the plan? Blackpool Teaching Hospitals NHS Foundation Trust needs to improve, and we have a 5-year plan to help us do so. We were told we needed to change in a number of areas following our latest inspection. This strategy sets out how we will not only raise expectations, but exceed them. Our vision is to improve the lives of people who live, work and volunteer on the Fylde coast and beyond. To achieve our vision, we'll focus on our people. We want to become an employer of choice. Our population. We'll work with patients to improve our services. Our responsibility. We'll develop new ways of working. Who we are. Blackpool Teaching Hospitals NHS Foundation Trust covers Blackpool, Fylde and Wyre and is part of Lancashire and South Cumbria Integrated Care System, ICS. We have 3 main hospitals, providing acute services to 330,000 local residents, as well as specialist care for services relating to heart conditions and blood diseases. We deliver community health services for more than 445,000 residents and host the National Artificial Eye Service across England. Plus, we provide urgent and emergency care services to around 18 million people who visit Blackpool every year. Our services are provided from the following main sites: Blackpool Victoria Hospital, Clifton Hospital, Fleetwood Hospital, Whitegate Health Centre, Lytham Road Primary Care Centre, South Shore Primary Care Centre, Fleetwood Primary Care Centre, Moore Park Health and Leisure Centre, National Artificial Eye Service. What we do: we provide care to residents of the Fylde Coast and those visiting the area. We have 7,521 staff, 68 nationalities. Who we look after: 1.6 million people across Lancashire and South Cumbria, 330,000 people on the Fylde Coast. In a year, there are 75,000 people seen in A&E, 2,900 urgent care visits, 118,000 walk-in attendances, 400,000 outpatients supported, 5,000 elective inpatients, 50,000 day cases, 50,000 emergency inpatients. More facts and figures. There are 800 beds across Blackpool Victoria and Clifton Community Hospitals. We care for 330,000 people living on the Fylde Coast, most of which, 97.4%, are white British. We have a £580 million annual turnover. We also have an ageing population. More than a quarter of people living here are aged 65 or over. By 2027, this group is expected to be more than double those aged 15 and under. What's the problem? Blackpool is one of the poorest places to live in England. In Wyre, there is a mixture of rich and poor areas, particularly in Fleetwood. Fylde is considered to be generally a rich area. Those who live in poorer areas often don't have the same chances in life as those living in richer areas. This can lead to poor health, and these difficulties can start from birth. Poorer areas tend to have more people who are overweight, smoke and drink too much alcohol. These people also generally find it difficult to access health services. There are lower rates of testing for cancer, for example. In Blackpool, a fifth of women, 20%, smoke at the time of their baby's birth, compared with 13.3% in Fylde and Wyre, and 9.6% nationally. Babies born in Blackpool have the lowest life expectancy in England. Babies in Wyre have a life expectancy below the national average, while Fylde babies match the national average. A quarter of children in Blackpool live in low-income families. To think of it another way, if Blackpool's low-income families matched the national average, there would be 1,500 fewer children living in poverty. Fylde's figure is 14.4% and Wyre's is 17.1%. Achievement at school is lower in Blackpool, but in Fylde and Wyre it's the same or better than the national average. Talking to other people regularly improves health and makes people less likely to be ill. But in Blackpool, 29.3% of adults are lonely, compared to 22.3% nationally. The figure is 23.5% in Wyre and 16.9% in Fylde. Early death from illnesses such as cancer, lung and heart disease, and alcohol and drugs are higher than national averages in Blackpool and Wyre, but in line with national rates in Fylde. Many of these factors put pressure on our health services and will continue to do so. We want to play our part in improving the lives of those who live, work and volunteer on the Fylde Coast and beyond. Male life expectancy at birth figures are Blackpool, 74.1 years of age, Fylde, 79.9 years of age, Wyre, 77.8 years of age, England, 79.4 years of age. Female life expectancy at birth figures are Blackpool, 79 years of age, Fylde, 82.9 years of age, Wyre, 82.3 years of age, England, 83.1 years of age. Children in relative low-income families figures are, for Blackpool, 24.9% children live in low-income families, for Fylde, 14.4%, for Wyre, 17.1%, compared to 19.1% of children in England who live in low-income families. Under age 18 pregnancy rates per 1,000 are Blackpool 31.1, filed 12, wire 18.7, compared to 15.7 under 18 pregnancies per 1,000 for England. Excess weight in adults figures are 71.6% of adults in Blackpool are overweight. 6.9% of adults in Fylde are overweight. 62.7% of adults in Wire are overweight, compared to 62.8% of adults in England who are overweight. Under 75 death rate from preventable causes rates per 1,000 are Blackpool 265.2, Fylde 135.5, Wire 164.8, England 142.2. What do we have to spend on this? Blackpool Teaching Hospitals will be allocated the same amount of money as it will spend, £580 million in 2021-22. Next year, it's expected that the same amount will be spent, but there is a goal to try and save £21 million. This could change if more money is spent to reduce waiting lists. The underlying money shortage of the organisation is about £150 million. This means we need to make savings to bring us back into financial balance, so that we're not spending more than we have available. What have we already spent money on? We spent £112 million over the last 5 years on buildings, equipment and IT to improve patient care and make our services more efficient. This has included cardiac, heart and lung machines, MRI scanners which produce detailed images of the inside of the body, beds for patients in our hospitals, operating theatre equipment, redesigning of accident and emergency. We've also invested in an electronic patient management system, wireless network infrastructure and digitisation to improve access to care. What do the regulators think? In 2021, Blackpool Teaching Hospitals received a rating of Requires Improvement by the Care Quality Commission, CQC. Following the CQC visit, we received advice in regards to areas for improvement concerning quality and safety. We've been working closely with the regulator to carry out the key steps for improvement and have demonstrated good levels of improvement against key areas, including death rates. However, we do recognise that more work needs to be done. Our 5-year strategy focuses on working with our partners to provide high-quality services, whilst recognising that giving our staff more power to create change is a key to continuous improvement. What will it be like if we deliver this plan? Our people. We will grow our own. We want to grow our own workforce and continue to do so for future generations. Blackpool Teaching Hospitals should be offering more opportunities to help young people reach their potential. We'll do this by telling more young people about the careers we offer, making it easier for people to get their first job, whichever role they want. We will also attract and keep trained health and social care staff by encouraging qualified people to come and work for us, come up with new ways to fill jobs. Once our staff are here, we'll invest in their future by showing how they can progress, offering ongoing training, giving careers support. We will create a happy and healthy workforce. Happy and healthy staff provide better care. We want to make sure everyone who works for us is treated the same and has the same chances. We'll improve the health and well-being of all staff by improving personal health and well-being, encouraging strong relationships between teams, helping staff stay fulfilled at work, supporting managers, providing a comfortable workplace, offering professional support should staff need it. We will develop a learning culture. Feeling valued and listened to is important. We pledge to give staff the skills they need to improve care and encourage lifelong learning. We also want staff to feel like they can speak up, recognise they'll be heard and know that we will take action. Our managers at Blackpool Teaching Hospitals play a key role in inspiring and leading our teams. We'll invest in and develop these roles to improve our performance and patient care. An example of how we grow our own. Healthcare assistant Stacey enjoyed her role working as part of a close-knit team, but felt she had more to give. Supported by her ward manager, she took on assistant practitioner training from 2015 to 2017 and was then recommended for a place on our first nursing apprenticeship cohort. She completed her university studies in December 2021 and received her professional registration in March 2022. This was a great achievement for both Stacey and the organisation, as it fits in with our ambition to grow our own, to retain staff, develop talent and help ease staffing pressures. Stacey, who has spent the whole of her career with Blackpool Teaching Hospitals working within the respiratory service, said, "The Trust has given me massive opportunities to undertake further training and progress in my career. I love my job and come to work happy every day." Our population. We will look out for and stop health inequalities. We will make healthcare more equal. We want to give everyone the same access to services and improve health, no matter what their background is. To start with, we'll concentrate on the following services: maternity, severe mental illness, chronic respiratory disease, early cancer diagnosis, hypertension. We know differences in care between different groups of people are happening. We'll use data to monitor what's going on so we can tackle problems as they arise. Our staff have an important role too. We'll give them the skills they need to spot inequalities and address them. We'll continue our commitment to integrated care. Improving care must be a team effort. Our team includes other health and social care providers and patients. Working with them, we will make sure we listen and get more people involved. We'll also work with community and primary care organisations so we can prescribe social activities to help address concerns or activities that may contribute to poor health outcomes. We'll support prevention and health promotion. Our focus is on helping people reduce the likelihood of being ill and prioritising prevention and early detection of illness. We want to train all staff to make sure that every contact counts, so that all our points of contact with people encourage good changes in behaviour that can help them live better lives. Changes such as stopping smoking, improving diet, increasing physical activity, losing weight and reducing alcohol consumption can help people to reduce their risk of poor health. We'll support people to take more control over their health and improve their well-being. An example of working together to tackle foot amputations. The Fylde Coast had the highest rate of foot amputations in the UK and was awarded funding to tackle this in 2016. We recruited 4 advanced podiatrists, medical specialists who help with problems affecting the feet or lower legs. 2 from outside the organisation and 2 existing employees. Staff also received extra training and additional equipment. Our action plan, with everyone working together, led to a significant fall in amputations, and waiting times fell from 11 weeks to 1 week. An extra effect of the effort was seen in our staff survey, with 100% of staff saying they felt their role makes a difference and they feel trusted to do their job. Our responsibility. We will get the basics right. We know we need to do better. Blackpool Teaching Hospitals is rated as requires improvement by the CQC, and we have plans in action to change this. Our aim is to achieve a good rating within 5 years by working with our partners to improve the quality of care. To help deliver this strategy, we will develop new approaches to education, research and innovation. Our estates, our digital infrastructure, our people, quality improvements, sustainability and environmental measures. We will develop new ways of working. Technology can help us provide better care. We plan to invest in our digital systems to help make the organisation work better in the future and be more efficient. One example is that we will invest in an electronic patient record so that we can share health information to improve care outcomes. We will also look at how we can deliver services differently by using technology to reduce face-to-face appointments when appropriate. We'll also plan to work with patients and carers to deliver services such as virtual outpatients and wearable technology. Feedback tells us that access to our sites can be difficult. We plan to look at where care is provided and to see if things could be done in a better way. We'll also work with our Fylde Coast partners to make sure we have the right transport links in place to help patients get to appointments. Clinical research helps us provide better care. Blackpool Teaching Hospitals is one of 5 national centres set up to deliver commercial trials, which look at the safety and effectiveness of different medicines, devices and techniques. Each year we run more than 100 clinical research studies, and we want to do more. Over the next 5 years, our goal is to become a university hospital and a recognised UK centre for research excellence. We want to make research accessible to all and look at studies that address the inequalities experienced by our region. We will invest in our community. The NHS wants to be net zero in less than 25 years. As one of the largest organisations on the Fylde coast, we have a significant environmental impact. This means we have the chance to make a positive difference in both carbon emissions and population health. Our Green Plan goals are to achieve net zero by 2040 for direct emissions, contribute to all the United Nations Sustainable Development Goals, achieving a 70% rating in our Sustainable Assessment Tool by 2025. We also aim to improve health by having a positive impact on local social and economic conditions. We'll do this by adapting the way we employ people, buy goods and services, use buildings and spaces, reduce our environmental impact, work with partners. An example of how technology is transforming sexual health services. The sexual health team used technology to come up with new ways of helping patients during the pandemic. They introduced remote testing kits for sexually transmitted infections, which patients can order online rather than having to visit a clinic. During 2020-21, 15,500 self-test kits were processed, and more than 18,500 were processed during 2021-22 across Lancashire. The team also launched e-contraception to allow patients to order repeat supplies of progesterone-only contraception online. Patients can enter their information online directly into their electronic patient records and onto the appointment screen. This allows more people to get contraception more easily and frees up appointments for new patients or those with more complex needs. A third new idea in the pipeline: a digital chat box function for the Sexual Health Service website to enable patients to ask a range of questions about their sexual health and contraceptive needs. Reaching our potential. Blackpool Teaching Hospitals has ambitious plans for the next 5 years that will focus on our workforce, the quality and safety of care, and our ways of working. We know we need to get the basics right first to deliver our mission of delivering safe, effective, and sustainable care for everyone, every day. We're getting there, and we know we can achieve our vision by playing our part to improve the lives of people who live, work, and volunteer on the Fylde coast and beyond.